welcome to the next video in our series of veterinary technician training videos. Today's video is going to be led by Dr. Andy Moorhead. He is a boarded parasitologist and associate professor at the University of Georgia. And he's also the director and primary investigator of the Filariasis Research Reagent Resource Center, where his main research interests include the role of host-specific cues in development of filarial worms. Dr. Moorhead has served on the board of the American Heartworm Society since 2016 and is currently the program chair for the 2025 Triennial Symposium. Welcome, Dr. Moorhead.
Okay, thank you, Dr. Rizzo. I appreciate the introduction. So today I have been tasked with talking to you about the basics of heartworm biology and life cycle. Now, on my opening slide here, as you can see, let me get to my pointer. I want to really emphasize 2 points which will be emphasized repeatedly throughout these series of lectures. Here, this is a dog that was unfortunately euthanized due to cable syndrome, and that is, of course, when there's a large amount of worms that are no longer in the pulmonary artery, and we'll get to those, why that's important with the life cycle. But this large number of worms caused an acute condition which caused the animal to have to be euthanized. And this emphasizes the importance of prevention, which you'll hear about. But I also want to make the point that this should not have happened if we prevented heartworm. Also, this is a picture of a cat that I took around the University of Georgia's campus. And this is to reemphasize the point that it is not just dogs that can have problems, but so can cats. And you will get a specific lecture on that, but it is just important to keep cats on preventive as it is dogs. These are my financial disclosures. I have worked for companies both that exist and no longer exist. Okay, we come back to this, the start of this. And once again, this is this cable syndrome picture, which normally can be anywhere between 50 and 100 worms. And having that large number of worms in your vessels can cause a huge amount of problems. But how did these worms get there? So when we're thinking about heartworms, and I've already talked a bit about what they can occur in, obviously dogs, and of course I'm at University of Georgia, so I chose this. And then of course, one of our rivals, Auburn, which cats can occur. While this may seem a little tongue-in-cheek, I choose these two mascots to really emphasize the importance that it can affect both animals. But guess what? Those are not the only things that can become infected. And if you look here from this infographic from the American Heartworm Society, and these are available on our website, you can see that this really emphasizes that it's not only dogs, not only cats, but also it can be in coyotes, which can be either wild or peri-urban, seals and sea lions, and also zoo animals. So for those of you that work in zoos, let's not forget that these the wild carnivores can get this too, and we really need to emphasize that to them. One thing that I do want to take a second to mention is ferrets. Ferrets can get heartworm. It is deadly to them. And not only do we recommend consistent administration of preventive to dogs and cats, but also ferrets. Now, you're going to get another video on this, but I always like to, at this point, to talk about incidence, because when we talk about biology and life cycle, we have to talk about where heartworm is at. And this is the 2019 heartworm incidence survey. Another one is currently being conducted. And what we can see is while heartworm definitely is in those areas where I am currently at and Dr. Rizzo is currently at, it is also in other regions that people do not traditionally think of where heartworm is at. And so with that being said, we are seeing a spread. And as you will learn, where there's a heartworm infected animal and there's mosquitoes, it can be spread even if you haven't historically thought that it could be there. Now, another extremely important point related to the biology of heartworm is that all animals' ages are susceptible to infection. There's no age-related immunity. The animal does not time out of being infected with heartworm. That newborn puppy to that 14-year-old animal all can become infected with heartworm. And so you cannot stop with consistent prevention through the lifetime of the animal. It needs to be on prevention through its lifetime. Now, with this, the important stages of heartworm, and that's what this talk is supposed to be about, biology's life cycle, is let's start here. These are adult worms. The females can be up to 1 foot in length, where the males can be ½ foot in length, live in the pulmonary artery. The reason it was called heartworm originally is when they first discovered it. If you have ever euthanized an animal and then looked for heartworm, or it has died of heartworm, those worms will be in the heart because there's no longer blood forcing it into the pulmonary artery. So that's why you see them there and where it's got its name. But what you need to remember is that its normal resting place is in the pulmonary arteries. These worms, or these adult worms, mate and produce baby worms called microfilaria, which circulate in the bloodstream and are then taken up, and these are the mouth parts of a mosquito, and I'm going to go into this more, taken up by a mosquito. They migrate in the mosquito, and after a period of roughly 2 weeks, become an infective third stage larva, or an L3, which I colloquially call the teenager worms. Now, one thing that sometimes happens in practice is people will use microfilaria and L3s interchangeably. And while talking about parasite stages, and it may not be important to the client, it's important as far as the difference in biology, because microfilaria cannot grow to adult heartworms without first going through the mosquito. And they are not the infective stage to a dog or cat. It is those L3s. Now, if we look at this on a life cycle, what we will see, and there are a variety of life cycles that are on there. There's different ones on the Heartworm Society site, certainly pharmaceutical companies, a variety of places you can find this. But I really like this one as it, I feel, shows things quite nicely. If we start here, this is where the adult worms are present in the pulmonary artery. Once again, they produce microfilaria, which then go through this mosquito. And this mosquito undergoes a migration in there, and it becomes the infective L3s, which then get into the host, undergo a complex migration where they eventually end up in the pulmonary artery, and 6 months later, after being there, will produce the microfilaria babies. With cats, it is a little bit different, and I will talk about this a bit more, but when it gets into cats, it takes a little bit longer. And while the adults can end up in pulmonary vessels, they tend not to produce those baby microfilaria. And this will become important later in the talk. Now, I want to take a bit more time to talk about the mosquitoes and their importance in this. With mosquito vectors, and these numbers are constantly updated, there's greater than 70 species that have been documented to be able to carry heartworm. And 10 to 16 species are considered more important or most important, but that, as I said, is being constantly updated. Now, what we tend to think lots of times is mosquitoes are either as daytime biters, or dawn and dusk biters. However, there are some mosquitoes, specifically of the genus Aedes that can also be daytime biters. So this is where I want to make a point that one of the old myths that if your dog's out during the day, it doesn't need to worry about prevention. That's absolutely not true, because we have mosquitoes that can bite during the daytime. And this is the Asian tiger mosquito, which is considered a very, very voracious feeder. Now, as a parasitologist, I love the nerdy aspects of life cycles, and this is one of my absolute favorites. This is work that was done by Steve Jones, past president of the Heartworm Society, and a researcher named Chris Evans. And what they actually did is they wanted to see how these L3s actually come out of the mosquito mouth parts. So if you look here, this is the head of mosquito. This is a dog ear on a anesthetized dog. You'll see a stylet, which is the sucking straw where blood is sucked. But you see these fleshy mouth parts labeled here, and you see this bend. What actually happens is that these the L3s, which once again, the infective stage, will bust out of this and end up on the surface where the stylet is going in. So these aren't actually being injected. They're resting on the surface. And when this stylet pulls out, these L3s rapidly disappear. I was fortunate enough to be able to be there and watch this experiment. And they went through that hole in about 30 seconds. So they disappear quickly. But once again, I want to emphasize these are not injected, but rather go quickly through that hole. Now, to show this in some other schematics, which I borrowed from Dr. John McCall, one of the stalwarts in our field, you can see this here, that the stylet is coming in and we're sucking up the microfilaria. Now, fast forward approximately 14 days, and these L3s will have come out here and been in this pool of hemolymph, which is basically mosquito blood. So it has been pulled, this has been pulled out, these L3s come out. And when that stylet comes out, guess what? Those L3s go through that hole where they will then stay for a bit, roughly 3 to 4 days before they molt to the next stage. Now, let's talk about this next stage a bit. And for now, I'm going to focus on the dog side. I've told you that those L3s get in, and then shortly, 3 to 4 days, molt to L4s. After that, they go through a long migration until they reach the pulmonary arteries at roughly around day 70, give or take. And that's when they start growing. When they get to this point, they are probably roughly an inch. And also during that time, they have gone from what are known as L4s to what are known as juvenile adults, which essentially are worms that are basically adults. They're just not old enough to mate yet. Then they end up in that pulmonary artery where they produce microfilaria, and that life cycle is continued. Now, most of what we know about this life cycle comes from a landmark article called Catani and Powers, which was published in 1982. And this article is basically considered, if it were, the main textbook on heartworm life cycles. And what these two researchers did is that they actually infected dogs, and every few days would euthanize them and look through the tissues for where the stages of heartworm were. This is an extremely intensive project that will probably never be repeated. So this is why it's so important, because this forms the basis of a lot of our knowledge. Now you can see in what I want you to focus here is this intermediate location. They were injected back in the right limb, and then they underwent a complex migration primarily in subcutaneous tissue, a little bit in the muscle, until they eventually would arrive in the pulmonary artery. And that's why I have this final location here. And that pulmonary artery, they would arrive at about day 70. This is the earliest that they can be there. Some articles will tell you that it can be in the late 60 days. So, and if you'll notice, there's a gap here, but it is somewhere around here. Then what they will see, and I'm sorry, this circle doesn't line up, but at day 120, most of those worms, you'll see they have gone away from that intermediate location and they are now at that final location. So by 4 months, most of those worms will be in the pulmonary artery. And what that means is that those worms can start doing damage even before we can detect them. Let's recap a few important life cycle facts of canines. Normal development mosquitoes from the L1 or microfilaria is 10 to 14 days. L3 is the infective stage. By day 70, where they're juvenile adults, they can be in the pulmonary artery, and this means damage can start. Once those worms are there, they start damaging the vessels, and they're adults by 6 months, which means they can start producing microfilaria, or the babies, as it were. Now, let's move over to cats a bit. And I realize you're going to get a separate lecture on cats, but I did want to juxtapose dog and cat biology in this talk. With cats, the interesting thing about them, if a cat becomes infected, it actually came from a dog. Dogs are microfilariemic, cats are not. So what that actually means is that a mosquito has picked up a microfilaria from a dog, it is developed to L3 and then infects the cats. Cats are not, if mosquitoes bite cats, they are not going to be picking up heartworm. It has come from a dog. Now, when we look at the life cycle of dogs versus cats, the time to adulthood, and realize this is to the best of our knowledge, there are lots of questions with the heartworm life cycle you think we should know, but we do not. 6 to 7 months for dogs, where it's a little bit longer in cats. Microfilaremia definitely happens in dogs, where it is transient in cats, meaning that you may not catch it. It is only there for a little bit, and for all intents and purposes, the cats are not microfilarian. Aberrant migration, and what I mean by this is we often don't find heartworms in dogs in places they shouldn't be. That doesn't mean it can't happen, but it doesn't happen that much. But since cats aren't really the best host for heartworm, what happens is that these larvae will end up in places they shouldn't. And that means that sometimes you will see them in the eyes, in the central nervous system. The reason that you see the worms there is not necessarily that there's a predilection, but rather people are going to notice neurologic signs in their animal. People are going to notice if there's something weird in the eye. If that worm has migrated to, say, the kidney or another organ, people aren't going to see it. So the reason when we talk about aberrant migration with cats, it's because you can observe those sites, not because the worm says, I want to be in the eyes or the CNS. The numbers present, dog, it can be few to many, but in cats, it is normally much, much less. Realize cats aren't the best host for this. They're like a house guest that is there, but you really don't want them there, but they're still in your house. And so there's not going to be that many of them. Lifespan is 5 to 7 years for dogs, whereas 2 to 3 years in cats. So it's feline heartworm life cycle. Few worms can cause life-threatening disease. Cats are usually infected with less than 5 worms, and diagnosis may be more difficult. With only 1 to 2 female worms present, if any, it can be difficult to diagnose. Transient microfilaremia, and Remember, very few cats are microfilaria positive, so they become infected from mosquitoes that have been fed on infected dogs. Now, with that, of course, with biology in the life cycle, what we see are the clinical signs that ultimately indicate infection. Early infection, there may be such things as few worms, cough, and tired, where in very severe cases, and other lectures will talk about this, there can be severe labored breathing, anemia, and potentially even fainting and heart failure. And yes, heartworm is a deadly disease. With cats, I'd like to point out it is a little bit different. Cats, it's more respiratory disease. You may have a cough and wheeze. You may have vomiting unrelated to eating or just being a cat. And certainly in these severe infections, blindness and seizures do if they're aberrant worms, and there can be sudden death. With that, I do want to emphasize it is a preventable disease, and if we prevent the worms getting into the pulmonary arteries, especially of dogs, that means damage will not happen. And that means that the dogs will be healthy and live a lot longer. I thank you for your attention.
Thank you very much, Dr. Moorhead. Now we're going to welcome Paola Dominguez-Lopez. Paola is a certified veterinary technician working at the University of Florida Small Animal Hospital in Gainesville in the Veterinary Community Outreach Program. She has served on the board with us since 2021 and has been extremely helpful in developing these video training sessions for technicians. And so next, she's going to tell us how she would communicate each of these points to a client in a practice setting. Welcome, Paola.
Thank you, Dr. Moorhead. Thank you, Dr. Riso. Welcome, everyone, and thank you for joining us today. Today, I will discuss how a technician can approach a discussion on heartworm life cycle with pet owners. Meet Charlie. He is an 8-week-old intact male German Shepherd. Charlie's dad is a first-time dog owner who wants to start him off on a healthy track. Charlie is overall a very healthy puppy. Diet, training, grooming were discussed during this visit, as well as intestinal ectoparasites and heartworm prevention. When the veterinary personnel offered heartworm prevention for Charlie, the client appeared interested and receptive to the heartworm prevention product, but the client wanted to understand the life cycle a little bit more before he could decide what prevention he would purchase for Charlie. The conversation started off by explaining that a mosquito bites an animal that is already infected with heartworms. Then that mosquito bites a dog. The larvae goes into the tissue and remains there for about 2 months. At this time, the prevention can be effective against the heartworms. If prevention is not administered, it eventually moves into the heart and bloodstream at about the 4th month. Then the adult becomes mature and produces microfilaria. From 4 months on, treatment is required. The veterinary technician informed the client that heartworms can live in the body system anywhere from 5 to 7 years. This infographic is displayed in the room. As the technician was explaining the life cycle, she pointed to the infographic for a visual and easier to follow for the client. It is also a good resource to make sure no information is missed while discussing items with the clients. Once the technician finished explaining the life cycle and any questions were answered, the following video by the American Heartworm Society was played for the client in the room.
We all want our pets to live long, healthy lives. One of the most important things we can do to protect our pets is to follow the recommendations of our veterinarians on prevention of common diseases like heartworm disease, a serious and potentially fatal condition that affects more than 1 million pets in the United States. Heartworm disease develops when a dog or cat is bitten by a mosquito carrying microscopic larvae of a parasite called Dirofilaria imidis. These worms, which can grow to 6 to 12 inches in length, live in the blood vessels of the lungs and heart in both dogs and cats. Pet ferrets are also very susceptible to this dangerous infection. When an infected mosquito feeds on a dog, cat, or ferret, the heartworm larvae begin a migration that ends with them living as adult worms in the pet's heart and vessels of the lungs. By 6 months of age, the adult worms begin to reproduce, releasing embryonic larvae into the bloodstream. When another mosquito bites this infected pet, these tiny larvae are ingested along with the blood meal, starting the heartworm life cycle once again. Soon the mosquito will be able to bite and infect another pet. While adult heartworms can live up to 7 years, worms die at various ages. As they do, the dead worms collapse and are forced by the blood flow into the smaller arteries of the lungs, causing damage that can be permanent. Signs of disease can include a mild persistent cough, reluctance to exercise, fatigue after moderate activity, decreased appetite, and weight loss. Eventually, as blood flow through the diseased lungs becomes more restricted, some dogs can develop heart failure. This is commonly recognized by a buildup of fluid in the abdomen and the appearance of a swollen belly. A large number of heartworms can lead to a sudden obstruction of blood flow through the heart and lungs. This blockage often becomes a life-threatening form of heart failure. Most dogs suffering from this condition will not survive without prompt surgical removal of the heartworm blockage. It's important to understand that all pets with heartworms have disease, whether or not their symptoms are recognized. And without treatment, heartworm disease worsens, leading to serious illness and even death. Although easy to prevent, heartworm disease continues to be a major health problem for pets throughout the United States. The best way to reduce the risk of heartworm infection in your dog, cat, or ferret is to give preventive medication year-round. Heartworm preventives are safe, easy to use, and affordable. Some also provide treatment for additional parasites, such as fleas, ticks, intestinal worms, and mites. Application of an EPA-registered mosquito repellent has been shown to increase the overall efficacy of a heartworm prevention program. Prevention is always safer and more affordable than treating the adult heartworm infections in dogs. There is no heartworm treatment for cats or ferrets, so prevention is essential. Talk to your veterinarian about the best prevention for your pet.
So once the client understood heartworms, he wanted to purchase a 6-month supply. It was suggested to purchase 1 month at a time until Charlie is full grown. We explained that the pet must be in the correct weight range in order to be better protected against heartworms. As the time passed, the client was compliant, bringing in Charlie for monthly weight rechecks and purchasing the heartworm prevention. Education is everything. A technician who takes the time to properly explain things to the client builds a relationship that the client will feel comfortable asking questions. Remember, a well-informed client is a compliant client. Thank the client for entrusting their pets in your hands. For more information and resources, make sure to go to the American Heartworm Society. There is information for everyone from clinic personnel to pet owners. There is client education handouts, incidence maps, infographics, videos, and more. Make sure to take advantage of it. Please go ahead and scan this QR code now for a free membership to the American Heartworm Society while you are enrolled in a veterinary nursing program. Thank you so much for joining us today.